Okay, just to let everybody know, this webinar is going to be recorded. Good afternoon, and thank you all so much for participating in this year's Developmental Screening Summer Webinar Series. My name is Dr. Teresa Northington, and I'm the Developmental Screening Coordinator for the Bureau of Family Health. And today, I will share with you some developmental screening quick tips for engaging with families in the screening process. Please know that this webinar is being recorded. Before we begin, I will read a disclosure. I, Teresa Northington, have disclosed that I have no relevant financial relationships. All remaining faculty, Louisiana AAP Education Committee members, and staff have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. All relevant financial relationships have been mitigated. For any participants, social workers, nurses, or physicians who would like to receive CE or CEU credit for attending this session, please be advised that you must attend the full session and complete the evaluation at the end of the webinar to receive credit. In our short time together today, we will review why we engage in developmental screening, some best practices and quick tips to engage and educate families, followed by ways to link families to resources and some available resources in our area. All right, let's get started. Before we get started on the quick tips, I want to take a second to review why screening is so important. The first 5 years of a child's life is the fastest period of growth and development. During this period, children experiencing unidentified delays in development can adversely affect their development and progress for years to come. For these children, developmental screening is the first step toward identification of developmental delays and risk, which can then allow families and children to begin down the path to appropriate early interventions and services. Currently in the state of Louisiana, according to the National Survey of Children's Health, 35.8% of parents reported completing a developmental screener during a well-child visit. While we are pleased to report an increase over time, we also want to be reminded that 35.8% is not 100%, which means that children around our state and families are not receiving developmental screening and subsequently being linked to services that they need for increased developmental health outcomes. Additionally, over about a 20-year period in the U.S., the prevalence of developmental delays and disorders has increased from 12.84% to 17.76%. So we can see that now more than ever, we must do all that we can to ensure all children are screened in order to get them to their best outcome and progress. Because we know through the process of developmental monitoring, surveillance, and screening, we can help place and lead families toward the path of early interventions and services, which can be the difference in a child's life. So we know it's important, but what actually is developmental screening? So developmental screening, in short, is the early identification of children at risk for cognitive, motor, social, emotional, and communication delays. It's the brief administration of a standardized tool aiding in the identification of children at risk of a developmental disorder. And these delays may interfere with expected growth, learning, and development, and may warrant further diagnosis, assessment, and evaluation. It is extremely important to note that we want to make sure that all developmental screening is being done with a validated and reliable screening tool, and to note that it should be completed by a parent or caregiver, because early identification is key. And to get this process started, we must begin to engage and educate caregivers on the process itself. And by doing that, we'll hopefully provide children with optimal outcomes. So, why is it important to engage and educate families? According to evidence based research, as well as best practices for conducting developmental screening, engaging and partnering with families throughout the process can not only increase developmental screening rates, but also yield a more positive outcome and outlook for families and children related to the developmental screening process. Which leads us to our first developmental screening quick tip, which is to create a safe space for families and children. Let's just take a second to think about and to reflect on the environment and feelings your practice, clinic, and well visits exude. Just take a second to think about that. Also, if you're a parent, think about the last time you visited or last time you went to a well child visit yourself. How did you feel? Do our families feel that they can walk in and they are greeted with a warm and inviting smile, information? How did you feel? How would you describe what families feel when they walk in the door of the exam room? Do they feel welcomed or rushed? Do they feel cared for or just a number or an appointment on the schedule? Are we creating an environment that is inviting? Because we must remember that that is the first step toward getting those families into the door. We can't screen them if they aren't there. So we must remember that when we're creating a safe space for families and children, we can create that safe space beginning before they even arrive. We can create a safe space for families before they arrive to their appointment by informing them ahead of time, by providing professional and inviting responses, whether it is a reminder that their upcoming appointment is coming via phone call, text message, email, with possible information in that correspondence that will help them understand what is going to be conducted at their upcoming visit. We can ensure we have an inviting and kind and welcoming waiting area, as well as front office staff when those families arrive. While we know it's often a rush when we're short on time, we can also create a wonderful and safe space for families to engage and share their concerns, reflect, and talk about results by taking time to fully engage with families, showing an active interest in the well-being of their child. So once we have gotten those families into the room, into this space, we can create that welcoming and inviting environment. We want to resonate with them. We want to be able to engage with families to address their concerns, insecurities, misconceptions, and possible lack of information surrounding developmental screening and their child's development. So how do we know exactly what we want to share with them? No worries. We have information directly from families. Who best to find out what families want to know and their feelings other than the families themselves? So according to a survey that was conducted, given about family engagement, 89.1% of families who completed the survey reported wanting to know more about the importance of developmental screening and next steps. So we see that there is a desire for families to really want to know more and to educate. And that also goes into the whole partnering and building relationships concept. We can educate and engage families in the developmental screening process by sharing the basics with families, telling them and educate them on what the actual definition of developmental screening is, why it's necessary, the benefits and risks. Because when we have family-centered care in pediatrics, families should be engaged as collaborative partners in developmental screening and surveillance practices. The act of screening itself provides engagement, conversations, and builds relationships with those families. We want to engage in conversations with them to let them know what is developmental screening, what their next steps might be if their child needs intervention. And all this can be done through family engagement, through education, and through those conversations with families and caregivers. Another way that we can educate families and provide that engagement piece is allowing them to get a little bit more knowledge about the whole process itself. To begin, we can let parents know that developmental screening is universal and all children receive this screening. It is our goal, hopefully, that developmental screening becomes normalized, that it is as normal as filling out other registration information when they arrive at a visit. Um, it's not targeted or labeling, but universal for all. We want them to know that we want the families to make sure that they know what developmental screening is. We want to provide them with a clear-cut definition so that they don't have to insert their own ideas of what it might be, what it could be, should be, but that they're very clear on what it is. We also want families to know exactly when it's going to occur. And we want them to know this ahead of time so that when they arrive to these appointments and they arrive to these well-child visits, they know at which appointment their child will receive developmental screening and what they can expect in that screening instrument, in that process, in that visit. We want to also help families understand the benefits of this whole process. And another tip that we can share with families and share with you all is when we are educating families on the frequency and what to expect at their upcoming visit, when it is an actual visit, well-child visit where developmental screening will be conducted, we want to share information that is directly related to their upcoming developmental screener. So we want it to be specific. Oftentimes we provide families with a vast array of information, and sometimes in translation, information, dates, facts, data can be lost. So it's very important that when we have families coming in for a general development screen, autism spectrum disorder screener, that we provide them with specific information related to that developmental screener. So they can look at that one specifically, they can take in the information on that one, and then they know exactly what to expect. And I have a link there that I'll share with everybody that is directly related to general development and something that you would be able to provide to families directly related to general development if you're going to be using possibly like an ASQ3 for that, something specific. So that's an example that you can look into once you receive the presentation. Another way we can educate families that was stated it came out of that same survey is monitoring and receiving guidance. Families also want to know how to monitor their child's growth. So, development and what to expect next. For parents and caregivers, it is important to know how they can help their child. We want them to be able to find the information, get it at the visit, but also we want to share with them the things that they may not know. A lot of parents at 89.7 said that having that information would be extremely useful because, as we know, oftentimes we don't know what we don't know. And for parents, it's the same thing. They don't know what they should know about their child's growth, about their development, and what to expect. And we have an opportunity to provide them with that information, especially through some of the materials that we're going to see a little bit later, some of those resources. As we also want to remember that when we're in a lot of these well-child visits, it's not just the parents, but it's also foster parents, grandparents, godparents who attend these visits. And sometimes they may not have had children for a long time, young children. And so we want to make sure that at every visit, we provide whoever is there, whoever is providing that care to the child with information, because you never know if that information is going to stay with the person who brings the child to the actual well-child visit, or if it's going to kind of get lost in translation. So providing information at every visit to every caregiver who comes into that room is another way that we can help them see and help them track. And through free resources such as Learn the Signs Act early materials, the Vroom app, 0 to 3, things like that, we can provide them with the necessary resources that they need to be able to monitor, see growth, and know what is to be expected. And lastly, we have one additional thing that we can also educate families on, and that is what to know about their child's overall health. So once again, 89.1% of families reported that they would love to know more about their child's developmental health, growth, and learning. And if they are doing the right thing, basically, if they are not, how can they assist their child? We can provide families with information on how they can best assist their child, things that they may not know, facts, quick tips, resources, applications, checklists, all those types of things, so that they can monitor their child's development. They can learn as well, so that when they go home, they can also research. They can find out more about what is given to them. We want families to know more about what milestones their child should reach cognitively, physically, emotionally, everything. And we can also do that through materials such as the Learn the Signs Act Early monitoring materials that are provided free of charge to anyone who wants to download them and order them. So what do these materials look like? So some additional quick tips are where we can find these materials. We want to educate families, we want to engage with families, and some of ways that we can do that is by providing them with clear-cut resources such as the Vroom app. The Vroom app and website is a brain-based learning site that allows families to gain knowledge about how they can best assist their child in activities to promote development. And this is a wonderful app and or website because it allows families to go on, select their child's age, select the area of need or the area that they would like for their child to work on. And then if they're uncertain about exactly what kind of activity they can do, where they can do it, how they can do it, how long it would take, they can put in all of those components and it will provide tons of examples, tons of activities of what they can do with their child, depending on the age, the domain, and the time frame. So it's a wonderful, wonderful resource for families. Another resource for families, like I'd mentioned before, is the Learn the Signs Act Early materials. And you can see over on the right side, there is a wonderful guide that says how to help your child, how to get help for your child and how to help your child. And this is a wonderful resource because so many parents and caregivers want to know what they can do, how they can do it. And this provides very clear and easy to read and understand information about how they can find help and how they can assist their child as well. Another tip for engaging families is through resources in the setting. So we want to make sure that when those families come in that door, that they feel like they have opportunities to get resources at every corner. So one thing that they can do is to create a resource or parent engagement corner. When they come into that waiting room, you can set up a place in the waiting room where families can have access to materials. Some places that I've seen have created parent corners that have tablets or iPads where they can look up materials, but others have also put in their resource corners just handbills, handouts, flyers, resources, available in their communities or statewide. And that is a wonderful thing where families can just kind of go in, peruse, see what is best for them, take the materials home, read them, and use them as needed. Another area where we can house these materials would be in the actual exam room when we check in, when we check out, and when they go to the exam room. And we can have them in a file folder. So when y'all are talking about family engagement, you're talking about resources, you're talking about results, you can just go straight to that file folder, pull them out, and hand them to the family directly. It's a wonderful way to have resources and things on hand, and it provides you an opportunity to discuss the actual resource with the family. And that often builds a little bit of relationship as well, because families like to feel engaged. They want to know that you are taking time to explain things to them, that it's not just here, take this paper and go on, but it's this is the information. This is what I would like for you to get from it. Please see this here. and they're able to then take it home and feel a little bit more informed. Another way that we can also engage families is just by talking to them. Sometimes we have heard that families, they do feel that sometimes they don't know how to speak with healthcare professionals. They're not sure what to say. They don't know how to voice their concerns. And so providing a space where families feel that they can share, that they can go over results is key. Developing that relationship where families feel a little bit more free is paramount. And one way that we can also do that is by providing sometimes parents and family members, they need a little bit of support. They need to know what they can say, what words, what will resonate with a healthcare provider. And a wonderful resource down at the bottom is called literally What to Say. And they can click on it and it provides them with a script and prompts on what they can say that when they're unsure about how to express their concerns, how to ask questions to healthcare professionals. Another thing that would be also a way to talk to families is to provide scripts for the office when we want to make sure that the same message is being shared with all parties, all families. We can create an aligned script that will allow healthcare, that will allow the front desk to say the same thing, that will allow nurses, whomever, medical assistants to all be on the same page, providing families with the same information. Because what we don't want to do is have different messages and then families feel confused and then they're uncertain who to talk to, who to go to. But when we have a universal and aligned message, it often creates a little bit more stability and it puts ease in the minds of families. So those are just a couple of ways that we can talk to families as well. Now we have some of those resources that I was talking about. So once we know that one of the best things and ways to educate families is to provide them with resources, things that they may not know about, they don't know how to locate. And we have some wonderful statewide resources that I will be sharing with you. So our first resource here is for providers, and this is a wonderful resource for clinics, clinic staff, providers of any in any arena, I guess, where we can offer developmental screening support, implementation and training support, customized plans, staff training, one-on-one coaching. We provide all of that, and it could be requested through this wonderful form. And when you request it, if you say, you know what, my clinic would love to improve our developmental screening rates, and we want to get some training done. We want to see how we can improve our processes, and we want to just kind of overall maybe just get some resource information. You come to this page and fill out the resource, fill out what it is that you need, and we'll get back to you with the training and support that you might need. Another tool would be our screening tools, training and guidance page, where we can help you understand a little bit more about each of the screening tools. So if you want to engage in developmental screening, but you might be uncertain which screening tool might work best for your clinic, might work best for your population, you can go on our page here and look at pretty much all of the screening tools that have been recommended. These are all validated and reliable screening tools, and see which one might be best for you. And if you, by chance, you go on there and you still have questions, my contact information will be at the end of the presentation, but we provide support for that as well. If you're uncertain which one to use, we can come in and kind of have conversations and get you to the best screener for your population and for your clinic. Another really wonderful resource are resource guides and tip sheets. These are amazing resources because they provide a plethora of information, resources, contact information for families related to general and social emotional development, family wellness, and autism. And these are wonderful because they are personalized and customized for each region of our state. So when you go on the page and you use the link there, you'll see that a statewide map pops up. And that map allows you to click on it, and then it'll give you the resources specifically for that region. And these are wonderful because they can be reproduced. You can copy them, print them out, and have them in those resource corners in the exam room. And they are easily able to be given to families and provide tons of resources, mobile application links, links to public school system, as well as recommended resources for each of those topics at the top. Another wonderful resource that we have is the Family Resource Center. And the Family Resource Center can provide information directly to families or talk to providers to help figure out what resources would be most beneficial for patients and families. It is open every day of the week, Monday through Friday, 8 to 4, and have amazing staff that are always willing to help and give families their undivided attention to link them with the best resources available for them. And lastly, here we have another resource, just like you're already here doing. We have some other opportunities for you to learn a little bit more about developmental screening through our webinar series. So we have our first one, which is today, but every week beginning July 10th, we'll have another developmental screening webinar around Medicaid, reimbursement, autism spectrum disorder, linking families to resources, and all the ones that you see. Just a little plug here for our next one, which is the Medicaid billing and reimbursements updates, which is going to be happening on July 10th. So I know it was really fast. I hope some of the information resonated with you all about linking families to resources and just overall engaging families and educating them. If you have any questions about how we can do any of those things, please feel free to contact me. My information is on the screen, and I thank you all so very much for attending. And once again, if you plan to receive, or if you would like to receive CE or CME credit for attending this webinar, please fill out the evaluation that will come once the webinar concludes. Thank you all so much and have a wonderful afternoon.